Hey guys, it's Dr. Michael, Chief Medical Officer at SUPMOGO and your spine and sports regenerative medicine specialist, here to talk to you about 4 different types of low back pain and the type of injections I use in my practice to treat them. I'll also be mentioning an excellent non-invasive alternative treatment for low back pain. So stay tuned. Number 1, lumbar disc herniation. Now what happens with this? You have your spine, you have your disc in between, which is a shock absorber and a cushion protection. Sometimes they get herniated and can touch the nerve, which is what? Shooting pain down the leg. Now what do we do for these? You've probably heard of them before. They're called epidurals. 3 different ways I can do this: going from the back, from the side, or from the bottom. Number 2, lumbar facet pain. What is facets? Facets are the hinge joints of the spine, kind of like the hinges on a door. Now as we age, they can rub on each other, creating arthritis and creating pain. And what can I do for these? They're called median nerve branch blocks. So we have nerves that supply sensation to these joints, and what I do is I block them. Very easy, under x-ray guidance. And what happens after that? If the patient does get relief, we can proceed to something called a radiofrequency ablation. Really easy procedure. I numb the patient up, I do it in my office, lay the needle down, and kind of sends a heat little signal there. Most patients can get up to 1 year or longer of relief with this as well. Number 3, sacroiliac joint pain. Now what is sacroiliac joint pain? Commonly known as SIJ pain. So you know that little dimple in the back? Okay, so that can send a shooting pain down your butt, kind of like herniated disc, but it's slightly different. So if you look at my spine model, it's right here where the 2 dimples are in your back. That can also send shooting pain to the front, right there at the groin. Now what do I do for this? Well, it's called a sacroiliac joint injection. I go in with my ultrasound or my x-ray machine, go slide right there, and put in some nice steroid or some biologics like PRP to treat that pain. Number 4 is disc pain. Yes, the discs can actually have pain. A lot of times people, when they sit for long periods of time and when they lean forward, that's actually the worst position if you do have disc pain, puts the most pressure on your spine, just in case you want to know that. Some people can have intradiscal pain, and what do I do for that? Well, you guessed it. I can go in with my needle under live x-ray, go into the disc and supply that with PRP, which is growth factors. I can actually heal the disc from the inside. Now, as promised, here to talk to you about an amazing non-invasive therapy option to treat your low back pain with advanced targeting technology, which is SUPMOGO. SUPMOGO delivers advanced targeted technology signals to the deep tissues of the spine, allowing what? Increased blood flow, less muscle spasms, decreased pain, and what? Posterior chain strengthening, allowing you to prevent more injuries in the future. Today we discuss different types of low back pain. Number 1, pain resulting from herniated disc shooting down the spine. Number 2, pain from arthritis in the joints of the spine called facet joints. Number 3, sacroiliac joint pain, and remember it can shoot to the front and also shoot down the back of the leg, confused with herniated discs, but it's not. Number 4, intradiscal pain. I hope this video provided you with some insight and knowledge on different types of low back pain, different ways to treat them. Subscribe and hit the bell to learn about SUPMOGO's upcoming latest development and new product lines. Trust me guys, you're not going to want to miss this.